you to the Health, Hospitals, and Social Services meeting on today. We have a few things that are up for discussion, and glad to have the community and the residents that are here. And as far as the members, we're going to go forward with our meeting. This is Resolution 2018-1048, sponsors Virtue Gilmore and others. This accepts a grant from Boulevard Bolt and to Metro for the use and benefits of Metro Social Services Commission to benefit a House Nashville program to aid homelessness. Is there anybody present from the homeless?
Move it first.
Yes. Oh,
So
yeah.
moved.
Can we move the motion?
Second.
Yeah. All right. Thank you. So we seconded. All right. Now we go forward to the Homeless Commission. Could you help us out with this?
Yes, the House Nashville Fund is a special established fund in our budget that 100% of any proceeds or any donations or grant contributions are paid for moving costs. We're really working as a collaborative, from a collaborative approach, and the Homelessness Commission serves as the backbone organization. And so we do receive some funds, but it's limited in nature. And this is one of those.
Could I ask something about the fund? Does it also accept, I would understand it would fundraise, but does it also accept donations as far as furniture and things of that for housing?
No, not,
Okay.
no. This is really for moving costs. We work with our partners. So in the past, we have paid for furniture, but not right now.
Gotcha.
It's really security deposit, first month rent, utility deposits to get people into the doors, and 100% goes back out. And it's actually service nonprofits and other agencies that serve as housing years work with people that apply for it, and it's paid out directly to landlords and utility organizations.
Okay. Any other discussions? All right.
Could I be recognized? I talked to Jericho.
Yes, sir. You can be recognized, sir.
Okay, I really appreciate it.
No problem.
The problem I have with this donation is that we have an employee for Metro government who is accepting money, which is usually handled through, in the parks you have that, it goes through the foundation, the police department the same. This is unprecedented to having a Metro employee that's taking donations from communities out there. If they apply for federal and state money, no problem. But once they go out in the community and they're asking for money and they're Metro employee, I believe that that's improper.
Can you speak to that?
It was all set up legally. It's a fund that's been established about 4.5 years ago, and those funds have come in on a regular basis.
And I want to be clear, when when there is a grant made, it goes to the commission to be, can you kind of just walk us through the steps?
It goes to this special fund, and it's a House Nashville designated fund, and I was told there have been other precedents in Metro like that. So we don't generally do a lot of fundraising for it, and we alert our partner agencies that utilize these moving costs, what is going on. And so this fund at the end of the year is really not reverting back into the general fund. It's not, it's one of the line items that it's just supplementing, and it's a flex fund that communities find is just because it really equalizes access to it for people that need it.
So what person is it, or employee is it going to?
Well, Judy Tackett is the person who's responsible for that, and the assistant director. But my point is simply this, and that is that there's $8,000 we're talking about. That's money that could go out, whether it's room at the inn or whether FS House or whatever else, and those funds are going to a government entity. And I don't believe that's the purpose of that. If anybody out there, there's limited resources for homelessness out there, and that $8,000, there's plenty of community work that's doing there. I don't think they're acting as a pass-through agency. It doesn't make any sense if that's the argument. So for me, the whole idea is that money should go out there. Metro Social Services should not be raising money, period. If they want to do that, they have to create a separate entity to do that, where they have their own board and everything. This is not the way business should be done in Nashville. We're allowing the Metro employee to raise money and determine how that's money spent with no accountability. And I don't believe that's proper for auditing purposes, and I don't think that's the best practice.
Mike, can you speak to any of that?
Not directly. It's really talking about legal questions. I
Right.
do agree that it's not illegal, that it's something that can be done within the financial structure of Metro, but it's getting to a little bit of a broader legal question, and that would be something for the law department.
Something for the law department or Jameson?
If there's some- I would really be more comfortable if he were answering that question. I was talking about, is it a best practice or is it something that can be allowed? My impression financially is that it is something that can be done, that it doesn't run afoul of Metro finances.
Can I amend my motion?
Is it let me ask one other question here. Would this hurt you terribly if we put this off and deferred it so we can get a little bit of a clarification from our legal department on this?
Not if you defer it, no. It's, I just need, one of the things, it's like this, the use of the funds is really benefiting directly people who move in.
Right, I understand
And
that. I
utilizing
mean,
that. Yeah,
a
no.
question has been raised about the legality,
It's-
and before
it's if you-
we move forward, I think it's prudent for us to do our diligence and make sure that we're not rubber stamping something that could have some issues. So I would be in favor of deferring it one meeting and getting an opinion from our law director on whether or not.
If we can get him in, I know we had some questions on this last. Would it be okay if we rolled this to the heel of the calendar? Could I make that motion, Chair?
You can, was there anything?
That was pretty much, I was gonna do the same.
Roll it.
Not roll it, I was just gonna ask for deferment.
Defer.
If you
All right.
want to see if we can do that and get Mike or somebody in here to speak to that.
Yeah,
issue.
we can roll it unless we get some legal that's here, but if
Because
not,
we
we'll
wanna be
defer.
Sure, yeah, if we need to defer, that's
I think it's
fine.
important to take advantage of this money. Just want to clarify so that we're not doing anything out of line.
All right, so we'll just move this to the floor. So for those who voted to defer this,
I don't think we had a vote.
oh,
We didn't
yeah,
have a vote on that.
So we're just gonna table.
Table
I'll
it.
just say roll it to the heel of the
Okay,
calendar. Is that okay?
Bring it up.
Yeah, that's fine.
Okay.
All right. All right, Bill, 2018-1049 sponsors Virtue Gilmore and others, accepts a grant from the Dorothy Kate and Thomas F. Frisk Foundation to Metro for the use and benefit for Metro Social Services Commission in support of the same program house Nashville Fund. No, we'll move this?
Motion.
Second.
Okay, all right. Could you speak to this too?
Yes, this one is, so the difference between this one and the first one, the Boulevard Bolt Grant, we did
Okay.
create an application. This one is the wish of the Frisk Foundation to contribute to this fund.
All right. Any discussion? Question? Go ahead.
Since it's the same fund, I'll make the motion to roll this to the heel of the calendar too. As we
So we
wait for
can
Mike to
address
get
it.
it. Yeah.
All right. So,
See, Mike Jameson is in the Rules Committee right now, but he's going to come here as soon as he can break free from there.
all right.
Okay.
So we'll roll this to the hill. All right. Let's move on to 2018-1060, sponsored Virtue and Gilmore, accepts a grant from the Tennessee Department of Health and Metro Board of Health to provide public health activities to enhance the health and well-being of women, infants, and families by improving children's resources and services delivery system available to them.
Motion.
Second.
All right. All right.
That's a program
Yeah.
called FEMUR, which is an acronym that stands for Fetal Infant Mortality Review. They have a crew of folks that look at every death of a child, or pretty much every, not all, but pretty much every death of a child under a year of age, to see what happened and if there are better service delivery models that would try to minimize those.
All right. So is this something that we have, this is a continuation of something and nothing?
It's about probably 12, 13 years ago.
Okay. Any discussion? All right. For those who are for this? All right. None against. Thank you. There's 5 of us. So 5 for, 0 against. Good job. All right. 2018-1061 sponsors Virtue Gilmore and Freeman. Approves a grant from the Adrian Boknick and the community members of the Metro Board of Health to provide emergency medical care for animals at the Metro Animal Care and Control.
Second.
All right. Health Department?
Yes, sir. This is a, I think that's a lady, Ms. Budnick. She does this every
Always
year.
does this. Yeah, she did this last year, didn't she?
Yeah, she does it every year. They have some sort of fundraising event, and they donate the money, the proceeds to MAC, and they use it for, we have a lot of animals that could be adopted if you could get their, whatever their medical condition is straightened out, and so we try to do that so that they've been adopted.
So this is another continuation of this. We're going to say for those who are, since there's no discussion, those who are for. All right, 5-4, 0 against. Thank you very much. All right, we'll move on to the next 2018-1062, sponsors of Vircher and Gilmore. Accept a grant from the U.S. Department of Health and Human Services and the Metro Board of Health to enhance access and comprehensive continuum for health quality, community-based care, and low-income individuals and families with HIV disease.
Second.
All right. So go.
I had to recuse myself.
You had to recuse yourself for that. All right.
Just
Gives us
not voting.
4.
What? NB. Okay. All right. Health Department, help us out.
That's an ongoing grant from the federal government passed through the state to us for HIV and sexually transmitted disease services. It's about just short of $1 million a year.
All right. Any discussion or questions? All right.
Yes, sir.
For those who are voting for it? All right. And we have one that has a recuser getting self, so 4 for, 1 against. Thank you very much.
One not voting.
And one not voting, yes. Thank you.
I know you're not against it.
And,
You can't say that.
yeah.
I can say that for you.
All right, we go to Resolution 2018-1063, Gilmore is the sponsor of this, a resolution approving the contract between the Metro Board of Health and East Tennessee State University to provide clinical experience opportunities for its students. For a move?
Motion?
Second.
All right, thank you very much. Health Department?
This one and the next one are both contracts. That's ETSU. The next one is TSU.
Okay.
So that their nursing and NPH students can come get some clinical experience as part of their education.
No cost to us at all, and it looks like liability's taken care of as well, right? Looks like any liability issues you're taken care of as well in this.
If you ever looked at one of those Metro contracts, they say, if we foul up, it's your fault.
Oh, okay.
Blind buyer signs one up.
All right, those voting for this? All right, 5-4 and 0 against. Thank you very much. I wish we could put both of these, the next one together because it's the same thing, but Resolution 2018-1064 sponsors Gilmore and Hurt, approves a contract between the Metro Board of Health and Tennessee State University to provide clinical experience opportunities for its students and residents in various health professions. All right. Motion? Okay. All right. Health Department?
Same thing.
All right, same thing. For those for this, please, by voting. All right, 5-4 and 0 against. This is for Tennessee State University. All right, resolutions 2018-1065. Sponsors Gilmore approves a letter of agreement between the Metro Board of Health and Tennessee Breast and Cervical Screening Program. To seek reimbursement from TBCSP for cervical cancer and screenings. All right. Okay, thank you very much. And Health Department?
So this is sort of an administrative necessity. This program is funded by the state, but it's only when we have this funded on a fee-for-service basis. This is the mechanism by which that's done.
Okay. All right, those for the, any discussion?
But I can talk a lot longer if you want to wait.
Oh, no, yeah, no, I think we're good. Any discussion? Any discussion? All right, for those four? All right, 5-4, 0 against. And I thank you guys very much. That concludes our meeting. We got two to the
Hill.
What's this? Approved. Okay.
See if I can break them for you.
See if you can.
Yeah, we have a few to the Hill, and I guess we'll revisit that as soon as we get people that are here. But any other new discussions with the health, hospitals, and social services?
You know what, I do actually have something that I want to discuss.
Yes.
And I know, I guess about a month ago when we voted for the hospital to receive that funding, I would really like to have some kind of update to make sure that they are moving towards coming up with a model and doing what we need for them to do in order for the actions to continue to move forward that's been suggested.
Where did they file those updates? Do they file them with us or the finance department?
Now, the finance, I think they file when they talk about what their actual, the data and metrics of what's going on financially. But in terms of the committee that they were supposed to put together and look at, developing a new model, that I don't think that there is. I mean, they may work with the hospital authorities, so I do think that we should ask for some, at least periodic updates from them.
I agree.
I think that makes sense.
All right. Any other input on that? Yes, I think there's updates that we need. Mr. Hospital, do you have any discussion?
Mr. Hospital.
So we're happy to provide any updates we can. I think we were still waiting for the vice mayor to appoint the committee unless they've already been appointed, and I don't know if they've met yet.
Yeah.
So that may be a little bit of money
Yeah,
right now.
yeah, it'd be,
So in Dr. Webb's mind, we've got the model, which is patient-centered medical home using chronic care principles. So you do a lot of preventative work, and it's actually working at the hospital. We have a reduction in the ER visits.
Right.
And we've taken 9% reduction in ER visits, and of the 9%, half of those folks were indigent, and they're now in our patient-centered medical home, so they're getting physicals and, mammograms and all those kinds of things that they never got, so they don't have to go back to the ER and use it as a primary care clinic.
How are they working with Meharry?
So, well, at this point, because most of our doctors are Meharry physicians. Right?
Okay.
all right. So, we're at this point back to the social services. Do we actually defer?
I'd move to defer one meeting.
Move to defer by one meeting. All right. Thank you very, very much. We will.
Both of those.
Both of them, yeah. I don't know if we can do that.
Yes, sir.
Can we technically?
All in favor? All right. 5-4 and 0
And
against.
then another vote for the other one.
And for the other one,
The first.
the FRIST, as far as the 2018-1049, we're going to move to
Defer one meeting.
Okay.
Second.
Okay, thank you. 5-4, 0 against to defer one meeting. Thank you guys very, very much, and we'll go on. Thank you.
Thank you.